Hello everybody, we will now be covering vital signs and chronic medical conditions. These are important and common conditions that you will see, and we hope that you will be able to appreciate these as you visit the elderly. These are the learning objectives for today. At the end of the lesson, you will be able to list and understand the 5 vital signs of the human body, define the chronic conditions taught in the module, categorize and list the risk factors for the chronic conditions, identify the complications of the chronic conditions, list the management of these chronic conditions, develop a holistic approach to understanding the impact of these chronic conditions. These are the topics you'll be going through today. Moving on to vital signs. Vital signs are vital, as the name suggests, as they denote important body parameters that give us a clue as to how well our bodies are functioning. They comprise of blood pressure, heart rate, respiration rate, temperature level, oxygen saturation, and blood glucose level. There will be a range of numbers for each vital sign that will be indicative of a healthy body. We will have a look first at the blood pressure. We usually use a machine to measure it, and the arm is normally at the level of the heart. It is usually recorded as 2 numbers. First number denotes the systolic blood pressure, and the second number denotes the diastolic blood pressure. The normal range of the blood pressure will be between 90/60 and 140/90. Anything persistently above 140/90 will be considered high blood pressure. The heart rate would denote how fast a heart beats in a minute. A healthy heart beats between 60 to 100 beats per minute. With each heartbeat, the heart pumps blood through its main opening to the rest of the body. A more truncated way of measuring the heart rate would be to feel for the radial pulse of 15 seconds and subsequently multiply it by 4 to obtain the overall heart rate over a minute. Regulation of temperature in a human's body is the homeostatic mechanism that keeps us at the optimum operating temperature. A normal temperature range would be 36.4 to 37.4 degrees Celsius. Somebody is considered as having a fever when the temperature exceeds 37.5 degrees Celsius. There are a few ways to measure one's body temperature, namely oral, axillary, which is via the armpit, and rectal. The respiratory rate is similar to the heart rate in the sense that it measures the amount of breaths a person takes in a minute. A normal respiratory rate would range between 12 to 20 breaths per minute. Someone will be considered being tachypnic, which is a medical term for breathlessness if that exceeds 20. Or someone will be considered underbreathing if the rate drops below 12. Oxygen saturation is the fraction of oxygen-saturated red blood cells relative to total red blood cells, both unsaturated and saturated in the blood. A normal level would be between 95 to 100%. If the oxygen saturation level dips below 95%, it will indicate that the body is experiencing hypoxia, which indicates inadequate oxygen level at the tissue level. Oxygen saturation levels are measured by placing an oximeter probe onto the fingertip, usually the index finger. One will wait for 30 seconds to 1 minute for the reading to come up. And this is the summary of the vital signs that we have gone through. Let's have a recap. Here are some questions that can help refresh your learning. I'll give you 3 minutes to think through them. These are the answers. If the resident has poorly controlled high blood pressure, what are some reasonable steps you can do to help him or her? As this resident has known hypertension, You may need to advise the resident to see his or her primary doctor to titrate the medications that they are taking. Lifestyle advice may also be given, such as reducing one salt intake. For question 2, ideally, we want to feel the pulse for 1 minute and count the number of beats over that minute. If not, another way would be to feel the pulse for 30 seconds and multiply the number by 2. A common area of feeling for the pulse would be the radial pulse, which is located at the wrist, and the upper limit of normal is 100. The normal temperature range for a human being is 36.4 to 37.5 degrees Celsius. Let's now move on to chronic common conditions that our elderly face. The first one is hypertension, or high blood pressure in layman terms. It is defined as having 2 or more elevated blood pressure readings, more than 140/90, taken on 2 or more different settings, with each reading being separated by at least 2 hours. Did you know that approximately 25% of Singaporeans aged 30 to 69 years old and 50% of Singaporeans aged 60 to 69 have hypertension? In general, a target blood pressure for people younger than 80 years old and/or those with other chronic diseases such as high cholesterol should aim for a systolic blood pressure less than 30 and a diastolic blood pressure of less than 80. There are specific targets for people with certain symptoms or medical conditions. Somebody that has protein in the urine, which manifests as frothy and bubbly urine, should have a target blood pressure of 130/80 and less. A person with diabetes should aim for a target blood pressure of 140/80. Having an uncontrolled blood pressure can lead to many complications in many body symptoms. Examples of body symptoms that can be affected are the heart, the eyes, the brain, and the kidneys. The common presenting symptoms for each specific organ affected are highlighted in red. Common medications used to manage high blood pressure, which you may find in the resident's house, will be on the next slide. These are some common antihypertensive drugs that you may find the patient to be taking. Some common side effects include low blood pressure and postural giddiness, which is giddiness worse when standing up from a lying down position. Moving on to hyperlipidemia, which is the medical term for high blood cholesterol. There are 2 forms of cholesterol in the body, the good and the bad one. HDL, or the good cholesterol, removes excess bad cholesterol and may prevent excessive cholesterol buildup in the blood vessels. LDL, or the bad cholesterol buildup in the inner walls of the arteries, contribute to the formation of cholesterol plaques, causing blockage of arteries, resulting in the hardening and narrowing of arteries. Targets for cholesterol are listed in this table below, with the important number being LDL, which we should aim for 3.4 millimoles per liter and less. Management includes dietary control by having more whole grains, fruits and vegetables in one's diet. Healthier unsaturated oils should be used when cooking, and saturated fat intake should be reduced. It's important to always check the cholesterol levels on your food labels before purchasing them. Common drugs used to manage high cholesterol are statins and fibrates, which is used to manage triglyceride levels in the body. Common side effects include muscle aches, liver impairment, which manifests via yellowing of skin, and right upper abdominal pain. Let's now move on to diabetes. There are 2 forms of diabetes that we may have, type 1 and type 2 diabetes. The main difference between both types of diabetes is whether one's body is able to produce insulin. In type 1 diabetes, the body is not able to produce insulin, whereas in type 2 diabetes, insulin is still produced, but the body cannot use it efficiently. In general, one usually develops type 1 diabetes during childhood, and type 2 diabetes is more common in adults over 45. This is a table that details the differences and similarities between both forms of diabetes. It is important to evaluate one's long-term control of diabetes, which is delineated by this biomarker called HbA1c. It is a reflection of a patient's glycemic control over the past 3 months, which is a better marker of a patient's diabetes control as compared to the ones of plasma glucose levels. This is usually measured pre-meals. The targets for glycemic control are HbA1c less than 7% and a fasting blood glucose of between 4 to 7 is considered optimal. There is a myriad of complications for diabetes. Those stricken with diabetes are at a higher risk of cardiovascular disease, diabetic eye disease, which warrants regular eye checkups to facilitate earlier detection of the condition. Diabetics may also complain of muscle weakness or numbness in the extremities due to nerve dysfunction. They may also experience kidney impairment, which may lead to end-stage renal failure, which requires dialysis. Common drugs for diabetes will be divided into two main groups: oral anti-hyperglycemic agents, or OHGAs. These are some examples below, and they are used predominantly in the management of type 2 diabetes. Insulin is a direct replacement of human insulin, which is not produced anymore in type 1 diabetes. It is therefore used mainly in type 1 diabetics. However, those with later stages of type 2 diabetes will ultimately require insulin replacement. The main side effect will be low blood sugar or hypoglycemia, especially in glipizide or glycoside and insulin use. And this is a summary of the chronic conditions that we have gone through so far. Let's now have a quick recap. So these are the 3 questions. I'll give you 3 minutes to think about the answer. You may pause the video if you so wish to. Are you able to recall one of the complications of hypertension and a common symptom? What are the roles of HDL and LDL respectively? What is the main difference between type 1 and type 2 diabetes? So these are the answers. One of the common complications of hypertension is heart disease, such as a major heart attack. Other complications include blurring of vision caused by hypertensive retinopathy, stroke, and impairment of kidneys. HDL removes excess cholesterol and may prevent cholesterol buildup in the blood vessels. Buildup of LDL in the arteries contribute to formation of cholesterol plaques, causing blockage of arteries, resulting in the hardening and narrowing of the arteries. In type 1 diabetes, your body is no longer able to produce insulin. In type 2 diabetes, your body produces insulin, but it is insufficient or the body does not use the insulin effectively. Finally, we will now be taking a look at 3 debilitating and deadly medical conditions. The first one is ischemic heart disease, also known as coronary artery disease. This occurs because the vessels in our hearts have accumulated with cholesterol and fat, otherwise known as atherosclerotic plaques, which impede the flow of blood. With our coronary vessels being blocked, we will experience symptoms, of which the most common are chest pain and shortness of breath. Women may tend to experience atypical symptoms, such as cold sweats and nausea, and approximately 1/4 of heart attacks are silent, which can be scary to think about. We have covered this briefly during the first part. There are a myriad of risk factors for heart disease. Modifiable risk factors include smoking, high blood pressure, high cholesterol, lack of exercise, and diabetes. Increased age and a family history of heart disease also increases one's risk of ischemic heart disease. Men older than 55 are at a higher risk, while postmenopausal women older than 55 also face a higher risk. Management of ischemic heart disease can be divided into non-pharmacological, which means that measures that do not require medication, and these include cessation of smoking, having a balanced diet, regular exercise, and optimal control of diabetes, high blood pressure, and high cholesterol. Medications can be used to manage ischemic heart disease, and these include blood thinners such as aspirin, beta blockers, nitrates, a certain group of blood pressure medications that are called ACE inhibitors, and finally, cholesterol-lowering medications. A common lung disease we encounter among the elderly, especially smokers, is chronic obstructive pulmonary disease, COPD for short. COPD lungs, essentially air gets trapped in the lungs due to loss of elasticity and shape of alveoli, which are air sacs in the lungs responsible for gas exchange. The various connecting tubes in the lungs or bronchi become inflamed and narrowed, causing mucus formation, resulting in a chronic cough. As mentioned, the single most important cause is smoking. Other causes are due to secondhand smoke, industrial pollution, and a genetic condition called alpha-1 antitrypsin deficiency. COPD is the fifth leading cause of death in the world, and compared to heart disease and stroke, its mortality rate is on the rise. Most sufferers from COPD present with a chronic cough, shortness of breath, and increased production of phlegm. With exacerbations of COPD, they can be overtly short of breath, and wheezing sounds can be heard when listening to their lungs. Unfortunately, there is no cure for COPD. Management of COPD includes cessation of smoking and, importantly, inhalers which aim to reduce the amount of inflammation in the lungs and open up the breathing tubes in the lungs, allowing for smoother passage of air through. Another condition that can be debilitating is a stroke. There are two main forms of a stroke. The more common one is an ischemic stroke, which is a blockage of one of the blood vessels supplying the brain, leading to cell death in that particular region. The other type is a hemorrhagic stroke, where there is a significant amount of bleeding in a portion of the brain. Some of you may recognize this, as this has been advocated to the public as a sign that one should look out for if a stroke was suspected. Common symptoms include unilateral drooping of the face, arm or leg weakness on one side, and slurred speech. Time is crucial in identifying a stroke, and if one suspects a stroke, the ambulance service should be called. Complications of stroke can be detrimental. Residents may be bedbound or impaired in their activities of daily living. They may have difficulty expressing themselves or swallowing. They are at risk of developing bed sores or lung infections. There are also medications such as blood thinning medications and cholesterol-lowering medications to reduce future risk of strokes as well. Management of stroke include diet and regular exercise, control of risk factors, and rehabilitation to regain as much function of the body as possible. Obesity has always been a perennial problem in Singapore. Overweight and obesity are defined as abnormal or excessive fat accumulation that may impair health. Body mass index, or BMI for short, is a simple index of weight for height that is commonly used to classify overweight and obesity in adults. It is defined as a person's weight in kilograms divided by the square of his height in meters. For adults in Singapore, these are the definitions. Being overweight is a BMI greater than or equal to 23, and being obese is a BMI greater than or equal to 27.5. The BMI provides the most useful population level measure of overweight and obesity, as it is the same for both sexes and for all ages of adults. However, it should be considered a rough guide because it may not correspond to the same degree of fatness in different individuals. These are the obesity statistics in Singapore. The prevalence of obese individuals from 18 to 59 years of age is 8.9%, while the prevalence of older individuals from 60 to 74 is 6.9%. Overweight and obesity are largely preventable. Supportive environments and communities are fundamental in shaping people's choices and making the choice of healthier foods and regular physical activity the easiest choice, which is the choice that is the most accessible, available, and affordable, and therefore preventing overweight and obesity. At the individual level, people can limit energy intake from total fats and sugars, and reduce the fat, sugar, and salt content of processed foods, and at the same time increase consumption of fruits and vegetables, whole grains, and nuts. Physical exercise is also key to managing obesity. Moderate exercises of up to 300 minutes per week should be undertaken. Examples include brisk walking, playing recreational sports such as badminton, or tennis, or squash, and cycling at light efforts. Not only do a healthy diet and regular physical exercise help you reduce weight, they also play a key role in non-pharmacological management of chronic conditions that we have discussed earlier, such as hypertension, hyperlipidemia, diabetes mellitus, stroke, and heart attack. Individuals who have such chronic conditions should be encouraged to participate in at least 150 minutes of moderate exercises per week. Finally, this is the last summary of the chronic conditions that we have gone through: ischemic heart disease, COPD, and stroke. As you can already appreciate, these chronic conditions will stay with the elderly for life. The official definition of a chronic condition is a medical condition that lasts at least a year and require ongoing medical attention and limit activities of daily living. These medical conditions are one of the main causes of death and disability, and they are linked to high-risk behaviors such as smoking, poor nutrition, lack of physical activities, and alcohol use. While it is important to appreciate that these medical conditions have to be managed appropriately, it is equally as important to reach out to the elderly and to form a long-lasting connection with them. Always remember that there is a face behind the disease, and we should focus on the patient. Let us now do a quick recap. I'll give you guys 3 minutes to think about the answers. Here are the questions. Let's recall the symptoms of a major heart attack. What are they? What risk factors can lead to the development of COPD? How would one manage a stroke? If you discover that the resident has not been controlling his chronic condition well, what would some of the reasons be behind this? You may pause the video at this time. Okay, here are the answers. For question 1, symptoms of a heart attack include chest pain or discomfort, shortness of breath, pain in the neck, back, or arm, and nausea. Question 2, the answer for this is the single most important risk factor is smoking. Other risk factors include secondhand smoke and industrial pollution. For question 3, the management of a stroke involves controlling of risk factors such as hypertension, high blood cholesterol, and diabetes. Rehabilitation is important to regain or improve function. Medications such as antiplatelets can be used to reduce future risk. Finally, the answer for question 4, reasons for a poorly controlled chronic disease can be due to possible increased resistance in seeking medical attention, not wanting to burden family, lack of education, and financial concerns. With that, I hope that this module has benefited you. You have gone away with a basic understanding of these chronic conditions. More importantly, I hope that you will be able to tie these things together with understanding how these chronic conditions can affect different aspects of an elderly's life and the approach we can adopt to interacting with the elderly and working together to tackle these issues. Finally, please scan the QR code in this PowerPoint for the post-module quiz, and I hope that you will enhance your learning. Alright guys, see you on the training day.